Hi, this video is for my soap note. For starters, ID of my patient. His initial is WW. He is a 65-year-old Caucasian male who was born in 1957. His chief complaint was nausea for the past two weeks. His HMP. Um, WW is a 65-year-old Caucasian male who came to the clinic complaining of nausea. Um, he states that few days before Christmas, he thought he had COVID. He had the typical symptoms of headaches, chills, nausea, and vomiting, which all subsided last Friday, except the nausea. He states that the nausea has gotten better from the onset, but has not gotten any better since Friday. It is constant, it's mild, it's really not affecting his appetite. At home, he said that he's been drinking ginger ale and something that his sister gave him to help with the nausea, but nothing seems to help, but nothing is making it feel better. He said that it's annoying, but not really affecting him. He states that only thing that has changed recently was in his medication. According to the patient, he was diagnosed with bipolar 8 years ago, but he's been recently been working with a psychiatrist who said that he was misdiagnosed. For the past 8 years, patient has been on multiple medications, psych medication. And about 2 months ago, the psychiatrist started weaning him off. He was on Adderall, lithium, Lexapro, Risperidone, and Klonopin. He states that the Lexapro was the last medication that he was weaned off, which he took the last dose week before Christmas. Patient states that he feels good for the first time in his life and is feeling optimistic. He has lost 39 pounds since he's been off the Risperidone. He denies chest pain, palpitations, shortness of breath, any changes in bowel or urinary habits, denies constipation, bloody stool. He denies hurting himself or others, and denies mania or feeling nervous or depressed or anxious. His past medical history includes type 2 bipolar, hypertension, obesity, hypothyroidism, ADHD, and GER. He's never had any surgeries. He refused the flu and COVID vaccine. Health screening. He had a Cologuard back in 2022, which was negative. His current medications include metoprolol 50 milligrams daily, Armour Thyroid 60 milligrams daily, and Prilux 40 milligrams. His history is pretty insignificant. There's no history of GI issues in his family. He doesn't know his father, his history, but his mother did have depression, Alzheimer's, and hypertension. He denies alcohol and tobacco use or recreational drugs. He does not drink caffeine. He is fairly on a new health kick for the new year. Aside from his nausea, patient has no other complaints, no pain, no diarrhea. His vitals are standard. He's obese. His BMI is 52.72. His temperature, all his other vitals were normal. His heart rate was a little bit elevated of 102. He's well nourished, dressed appropriately. He is able to carry on a conversation. He's afebrile. All of his physical assessment was normal. There was nothing abnormal about it. There was no discoloration, any jaundice of his skins. Heart rate, his heart sound was good. His cardiovascular assessment was normal. His pulmonary assessment was normal. His GI system, he had active bowel sounds, no tenderness, no distension, no enlarged organs. I mean, essentially everything was normal. He had no other complaints aside from the mild nausea he's experiencing for the last 2 weeks. My assessment for my differential diagnosis, my primary is the antidepressant discontinuous syndrome. According to Hirsch and Birnbaum, antidepressant discontinuous syndrome can happen when medication is abruptly stopped or if the medication is tapered too quickly. The patient has been on a lot of medication for a long period of time, and the 2 months seems like a very abrupt, a quick stopping of his medication. It is evident by flu-like symptoms, the chills, the nausea. Those are all symptoms that's associated with antidepressant discontinuous syndrome. The onset was 2 days after his last dose of Lexapro. In addition, according to Hirsch and Birmingham, concurrent centrally acting medications such as antihypertensives can increase the chance of this syndrome. My other differential diagnosis is post-COVID-19 condition, nausea. I ruled that out because there was no confirmation of COVID-19. Another one is anxiety. I ruled this out because patient denies feeling anxious, and as well as the fact that patient states that this is the best he has ever felt in his life and feeling optimistic. Since antidepressant syndrome is self-limiting and can last up to 4 weeks, my treatment plan is to provide him Zofran 4 milligram Q6 hours PRN to help with the nausea. And hopefully that will take care of it. And if it doesn't, we'll do a follow-up in 2 weeks and get him a referral to get a CT scan of the abdomen to make sure there's nothing going on. Thank you, and I appreciate everything. Any feedback. Bye.